Ito pang mayaman to eh. Pang mayaman. Oh.
Assalamualaikum. To our very own doctor, to our very own hospital director, Dr. Ahmad Sadoun, our nursing director, Ma'am and Tita Anaklu, our doctors who are present right now, my supervisors, and my colleague nurses. Good morning to all. So often we encounter with the patients and family members who are refusing or unwilling to do diagnostic exams, specifically if it involves exposure of private areas. And then a lot of times also, there are patients who refuse to do laboratory tests, like blood extractions. And then mostly we will hear from them, So we will ask, as a healthcare providers, we will ask ourselves why? Why are these patients is refusing to do when in fact what we are doing for them is for their own benefits? Well, it's because they are not informed or aware why this procedure is being done to them, or they are not informed beforehand. So today, I will tackle about one of the vital topics which will be discussed to the patient upon admission and discharge of the patient. That is the patient and family education. So, according to our hospital policies and procedures, patient and family education is the process of informing the patient and his family about a health matter in order to secure an informed consent, in order to gain patient cooperation, as well as that would lead us to compliance with the patient. So, we will ask what is the purpose of patient education and family education. So, in our hospital policy and procedures, we have a lot of purposes, but I will just summarize it into three. The first one is to give the patient appropriate information about their illness and the required medical cases, which is in the part of the doctors, as well as the required nursing care, which is in the part of the nurses. Second is to encourage patient and family participation in decision-making about their healthcare options, and layering out to them what are the consequences of the options they have chosen. By doing this, we are giving the patient a sense of authority to decide for themselves, or to be involved on the treatment regimen that they want to apply for themselves. Since it is their health and it is their life that we are dealing with, it is only a must and their right that they have to be involved. So, right now, every hospital, and even our hospital, which is the DFAD Specialized Hospital, we have our own policy as well. And I'll just summarize it again into three. The first one is that in our policy, patient and family education is an interdisciplinary and a collaborative process designed to meet the needs of the individual patient throughout the continuum of care. That is why all patients and the identified family members must be provided with appropriate education pertinent to the diagnosis, problems, and needs during initial and ongoing assessment. So what is this assessment that I'm talking about? Before we educate our patient and family, we have to assess the patient with the 7 categories. And these are the cultural and religious practices. Every individual or as a person have their own beliefs or religious practices that must be respected by us as a healthcare providers, because this is the way how they deal their healthcare problems with. The second is the emotional barrier, desire and motivation to learn, the physical and the cognitive limitation, language barriers, which is most of us as non-Saudis were having problem with that. So we can even seek help from our colleagues like the Saudi nurses to explain to our patient very well what is the healthcare that we want to give them. And then the last is the topic and the willingness of the patient to learn. Then the third one of our policy is that we have these so-called primary coordinators of patient and family. So who are these persons that I am referring to? This is we as the healthcare providers, which are the doctors, the nurses, the pharmacists, dietitian, and physiotherapy. So how are these people collaborate with each other or coordinate? For example, the patient is having is asking about his rehabilitation. So we will ask or we will seek the help of a physiotherapist regarding his rehabilitation or therapy. Then if it comes to his or her medicine, we will ask or seek the help of a pharmacist because they are knowledgeable about this. Then when it comes to the diet of the patient, we can ask the help of the dietitian. Then in the doctors as well, as I have observed in our hospital, specifically in the medical side, they are having this referral or consultations. Like for example, the patient is having a urological problem. So we will seek the help of urologists, plastic surgeons, like that. So we're having a collaboration and coordination together. So now, how are we going? The question is, how are we going to educate our patient? What are the resources? So there is 4 types of resources. We have the one-on-one presentation wherein it can be a nurse-patient interaction, or it can be a nurse or doctor's interactions, or other healthcare provider. The second is the group discussion, where, for example, when there is a specific, for example, there is a group of hypertensive or diabetic patient, and then you can group them together. And I think this is very healthy for them because it supports, it gives them a psychological support. Because, for example, I am a diabetic patient, and I can see that there is also diabetic patient in me. I can feel that I have the sense of belongingness, that I am not the only one who is having this problem. So we can discuss, we can provide them enough information. Then, one of the breakthroughs as well nowadays is the videotapes, providing them an informative CDs or DVDs regarding the healthcare or health problems. Then the last one is the very accessible and readily available in our hospital is the pamphlets and handouts, which is here. And I have seen in the OPD, we have a translation of Arabic and English pamphlets to provide enough information to our patient. And then, my dear Dr. Salim, what do you do with your patients once he or she has been fully recovered from your care, from your medical care? I mean, what do you usually do with your patients? It stands what do you usually do when the patient has already fully recovered from your
So discharge mo na.
medical care? What do you do usually?
Discharge.
Yes.
Yeah, discharge.
So, when the patient has already fully recovered from our side, we will discharge the patient. And according to our policy, during discharge, our patient must be provided with enough information regarding what? Their medication, how they're going to take it, and then follow-up appointments, for example, to doctors of nephrology, plastic surgeon, urology, or even neurosurgery if it's needed. And then, of course, the dietary, the diet of the patient or the lifestyle of the patient. So, let me just give you a gist of what I have told you. It only entails 3 words to summarize the patient and family education. When we educate our patient and family, we gain their trust, right? Yes. And then when we gain their trust, we gain their cooperation and compliance, right? Yes. And once we gain their cooperation and compliance, this will lead for our patient to achieve maximum recovery and functioning, which in our nursing care, we call it as an optimum level of function. So, we as nurses, doctors, pharmacists, dietitians, and physiotherapists, and other healthcare providers must work hand in hand in order for the patient to achieve optimum level of function. So, I am Nina from the medical unit and one of the coordinators of the patient and family care. That's it.
Yan, ka na sa side.
Brochure.
Brochure.
Give her first. Give her the whole one.